Welcome to another episode of The Granite List Live. I'm your host, Sally Pace, and together we're going to explore all things human capital and employee benefits related. Today, I'm joined by Joanne Eason with 5 Wishes. Welcome, Joanne.
Hey, Sally. Thank you so much for having me on.
We're really excited. You represent a portion of the industry, the benefits industry, that I would say impacts every single employee at some stage in their life, or almost every single employee, and yet really hasn't been something that's been discussed in the broader, HR benefits arena really until the past couple of years. It's really started to take light. So do you mind just sharing with our audience what 5 Wishes is and how it came about?
Certainly. So 5 Wishes is an advanced care planning program. So for the most part, it is a living will. And we have been doing this for over 25 years. We're a program of the national nonprofit Aging with Dignity. And it was started by our founder, Jim Toohey, who was the legal counsel and confidant of Mother Teresa. And through his work in her Homes for the Dying, he learned what was really important at the end of life, what became necessary. And yes, it's important to have a healthcare agent speak for you if you can't speak for yourself and know what kind of medical treatment you want or don't want at the end of life. But what really becomes important are those existential areas of comfort and personal relationships and spirituality and all that. And that's what encompasses 5 Wishes and makes us different from any other advance directive that's out there. Several years ago, we developed an employee benefit program called 5 Wishes at Work that has taken off with employers, and they're offering it as a benefit that rides alongside the healthcare benefit for their employees. And the reason why it's become so important is there's a lot of research out there that says that people who plan in advance for their healthcare are 16% more likely to be more healthy. So right there, that ends up being a return on investment. And then also, people the last 6 months of life, that's when 80% of their healthcare spend is done. And that's because most of the time, 25% of people have an advance directive. So that means 75% of us are getting the default in healthcare, which is everything. And as it should be, if the medical team doesn't know what you want, they should give you everything. So by people documenting this, it becomes less of a financial burden on them at the end of life and their families, as well as their insurance carrier and their employer.
So speaking of, obviously, our focus is the employer market. Talk through a scenario of how this works out and what kinds of employees are taking advantage of the service.
We work with employers that have 5 employees, all the way up to those who have tens of thousands of employees. And it really depends on what the goals of the organization are. Obviously, if it's a smaller employer group, they're going to provide this as a benefit to everybody. If you're talking larger groups, we really kind of subset it where we look at a demographic of those 40 and older, because those are the ones that are taking care of older aging relatives. And then they're having also those high school students potentially that are graduating and they're going on and adulting. And this is something that they have to think about as well. So we kind of will subset that demographic with them. Or some employers, if they're very large, use this as a supplemental benefit. And then it is available as an employee needs it. I think the really interesting thing about that aspect is there's a premium portion of our program. So the 5 Wishes at Work program allows an employer to provide their employees 2 advance directives, so 2 5 Wishes documents, a conversation guide for the employee to walk them through how to have the conversation with their loved ones and their doctor. And that can come in paper or digital format. The premium version also allows the employer to offer a trained professional to help facilitate those conversations. So if these are very difficult, if the employee has a serious illness and really needs to have this conversation, or their parents have a serious illness and it's taking them away from their productivity at work because their head's somewhere else because they're not sure what mom wants. This facilitation service really is beneficial because it's a trained professional who knows how to elicit the right information for people so that their wishes are documented well. And then from the employer standpoint, the administrative standpoint, we have a whole dashboard of resources available to employers, slide decks and launch plans and information on grief, and how to support your employees if there is a serious illness within the work group or within the work group's family members. And then there's just a whole array of different resources we can provide. And then we also have toll-free number support for the administration part of it, as well as the employees, how to complete the document.
Yeah, and I think I just heard something that I want to parrot back to you to make sure I understood it correctly and for our audience. You were talking about how I, as an employee, may have a loved one that needs this support. So I can take advantage of it through my employer for another family member. Is that correct?
Correct. So it could be for the employee or it could be for the employee's family member. So we have employers who provide it to their employees. And like I said, they get two, so one for them and their significant other. And then they provide additional resources if that employee has an aging and frail loved one who needs support, because it's proven that a third of adults right now are caregiving, and that's pulling you away. And some of the reasons that pulls you away from being present at work is because you're always questioning, am I doing the right thing? Am I doing enough? Well, Five Wishes actually is that workbook. It's a roadmap of saying, this is what good care is, and this is the kind of care I want. So once it's completed, that lifts a little bit of that, oh my gosh, what am I doing, off your shoulders, and gives you that peace of mind, not only as a good son or daughter or nephew or niece, but also as just as a gift.
Yeah, that hits really close to home as someone who is sandwiched in between a young child and aging parents. Sorry, mom and dad, I love you very much, but yes, you do qualify as on the aging side. You talked about size, that it could be any size, but could you tell us some of the trends in the types of employers you see that are taking advantage of Five Wishes at Work?
It runs the gamut, Sally. We have small nonprofits. We have financial wealth organizations that provide it to their employees. We work with the State Department. So anytime one of their team members moves out of the country, they're provided this as a service, as a benefit. We work with large manufacturing organizations, agricultural organizations. So like I said, it runs the gamut.
And can you talk a little bit about the pricing model for the employer facing program?
Sure. So our base rate, and this is for the smaller groups, it is $10 per employee, one-time charge. That's it. It's not per employee per month or anything. It's we look at your census or the group that you want to send it to or make it available to, and it's based on that. The larger you get, that number comes down. If you choose to do the facilitation rate, that starts at like $150 for a really small group and then goes down to $100 per facilitation. And those facilitations can last an hour to 2 hours.
Joanne, it's always fun for us at the Granite List to work with organizations that have already done really great things for the general public and then realize that they can specifically take that program, that model, into the employer space and use it as a recruitment and retention tool, perhaps. Certainly something to help offset, like you said, the emotional burden that employees feel when thinking about their loved ones. If I'm an employer listening to this, what are the top things you want me to know about this program?
Certainly, there's a couple things that are important. Every person who goes in for an annual wellness visit, so when you hit 65, your medical provider is going to ask if you want to have an advanced care planning conversation. It's just mandated in Medicare. So they will go through and pretty much just tick it off saying, yep, we had the conversation. As you age or as you have a disease and it gets more chronic and more debilitating, these conversations with your healthcare provider will increase. What we're trying to do is normalize these conversations within the public. And because really your advance directive is the only time that you have a voice in your medical record. If you think about it, every other thing that's in your medical record is from a clinician, a lab report, a blood test, you name it. This is your chance to say, this is who I am, this is what's important to me, and this is how I want to be treated. And as you get more ill or as you age, those values change. But what's really important is that we start thinking about this at a younger age. 65 shouldn't be the time we're starting to think, oh gosh, I need to start putting this in order. Now, when we turn 18, that's when you start needing to have this, because we never know when a serious accident is going to happen and leave us incapacitated. And then it leaves our loved ones guessing, what do I do? What do they want? I'm not quite sure. This lays out a roadmap of not only the medical care I want and who I want to talk for me, but it also lays out how much pain management I want. Do I want to be able to have my pain managed, but do I still want to be able to converse with my loved ones? Or do I just I don't want to feel anything and I'm going to be blanked out? It also talks about what kind of music do you want to listen to? What would bring you comfort? Do you want pictures around? Do you want your pets around? What do you want your loved ones to remember about you? So it really gets into some deep philosophical stuff that sometimes, if you're 18 or 25 or 35, might be a little disconcerting, but we've worked with many people who say that when they get to those questions, it really kind of helps them set out the legacy that they want to create for themselves. So it's not only advanced care planning with your health care, it's advanced care planning for your life and the person that you want to be, and it helps frame that. So this is a document and a program that's for everybody. And we shouldn't be afraid to talk about this. It doesn't mean that if you're talking about it, death is going to be imminent. But it's a way to be well planned and part of your estate planning. We're not afraid to talk about financial planning. This is just another one of those things that we should all be talking about and planning for.
Well, and I think it is so brilliant the way that you all have tied it into the employer space, because naturally during open enrollment or new hire, people are thinking about long-term disability, life insurance policies, all those things that naturally tie into what you all are so beautifully packaging as the advanced stage planning, but we're doing it on the financial side already. So it does make perfect sense. As we're coming to the close of the show, you've done such a beautiful job of outlining the offerings in it. Is there a success story or a story you could share about Five Wishes at Work in action?
So yes, so a lot of times when employers actually use Five Wishes, it's because they've had an experience with a loved one themselves, and they realize the value of advanced care planning, so they bring it in as a benefit for their employees. One of the clear ones that I remember is the CEO at Banner Health. He was such a strong proponent of advanced care planning that patients needed it, but before patients should have it, all the employees should have it. And that was, he had 10,000 employees. So that was something that we're going to walk the walk and talk the talk at the same time. So that was very eye-opening. And it's great because Banner Health is, one of the top health systems in the country, and they're living that patient-centered care by making sure that their employees are taken care of.
That's a beautiful story. Thank you very much. So, Joanne, if somebody's listening, they're an employer, they're a benefits advisor, they're another point solution that is interested in learning more and considering Five Wishes at Work, other than the Granite List, what is the best way for them to get in touch with you?
The best way is to go to our website at fivewishes.org, and 5 is spelled out. You can also look for our Five Wishes at Work page on the website, and it walks you through all of the different benefits, and it will definitely connect you with me as the next step.
Thank you again for being part of the Granite List community. We are so proud of our partnership with you and so proud of the work that you do in helping employees care for themselves and their loved ones. So thanks, Joanne, for being on today's show. And thank you to our audience for tuning into another episode of the Granite List Live.
Thanks, Sally. And thank you so much for all the great exposure that you're allowing us as a nonprofit to have with your members and within the employer community.